welcome. My name is Dr. Alexander Meininger, orthopedic surgeon and sports medicine specialist from the Steamboat Orthopedics and Spine Center. I'm here joined by...
I'm Ray Dagley, a physical therapist and bike fitter for Kinetic Energy Physical Therapy.
And I'm Amy Charity, a co-founder of SBT Gravel, professional cyclist and a cycling coach.
Our goal today is to discuss some common bicycle-related injuries, their rehabilitation and prevention. When people ask what are the most common bicycle-related injuries, they're often overuse-related, so we can look at upper and lower extremity injuries alike. The goal is not only identifying those potential injuries, but also using our training regimens to help prevent them.
The best way to look at training is really to look at the entire year and how you build. And one of the most important things is that gradual progression. I usually say 10% increases per week. I don't know about the two of you, but recovery and rest is something that's often overlooked for cyclists. When you start getting fit and feeling good, you want to continue training. And I actually think that's one of the most important parts, is that taking a day off, having recovery weeks, doing cross training, taking some time off the bike is really where a well-tuned cyclist will actually get fitter and get faster.
Indeed. No, I totally agree with you, Amy. And Ray, when we see those imbalances or overuses that are kind of ground in place, how do you approach them?
Well, kind of like what Amy had said, and that's typically when people are ramping stuff up and they're just not seeing that recovery time, that's when the overuse injuries really pop up. So when we get them in the clinic, it's like, all right, we've got to establish here, what needs to be done from, a strength standpoint. Do we see some weakness? We know it's a quad dominant sport, but, glute is so important, especially for the position that you're going to be in. So it's like, we really need to go through, look at some of those exercises and see how much control they have. The other thing is if it was overuse because of a bike fit issue, and so, it just took time to manifest itself, it's like, well, we've got to go in and look at, okay, what's the rider look like on the bike? So, trying to, juggle between those two things is kind of an art, but boy, when you can get it right, it's really successful for the rider.
Starting to understand what somebody's threshold is. We call it your FTP, your functional threshold power, and once you know that number, that's what an athlete can maintain for an entire hour. It's their absolute hardest that they can go, and we measure all of this in watts. So it's what power output you can do for an hour. Once we know that, we can break down the different zones that you have for training. So there are days that we want you at the very top end, anaerobic capacity, where you can only do an effort for 30 seconds or less. And we want you in your recovery zone for some days. So to build a training plan to get people faster, it's really looking at all of those different training zones, which are built off of your FTP, and making sure that you tap into each one of them over time.
One of the most common complaints we see in the orthopedic practice is knee pain. So cycling, being a lower extremity dominant sport, relies on the quadriceps and the hamstring muscles, and that high cadence or repetition of the pedal stroke is going to contribute to overuse type of injuries. These are often imbalance type problems where the iliotibial band or the tight structure on the lateral aspect of the thigh or the patellar tendon may develop symptoms of anterior knee pain. These are those patients in the office where you can assess balance of the pelvis or single leg stance, or you might find even on your own bike when you're riding, if that thigh comes close to the tube or you find it's not an upright piston. These are those patients then we can send off to therapy with an identified imbalance or work with our therapist to generate a program.
Yeah, we look at get the rider off the bike, and we'll look at a lot of single leg exercises, single leg deadlift, single leg squat, pistol squat, any way we can really isolate to see between strength of glute versus strength of quad and try to kind of sort out those imbalances. From a fitting standpoint too, really important, like Alex said, with that pistoning motion, it's like if you're seeing that knee circumduct quite a bit, it's like, what's the pedal look like? What's the, the cleat position? Is all that in a good place to allow for that proper pistoning? Same thing with saddle height and positioning on the bike. That can lend itself to extra forces on the knee. When you get somebody that's had some of these knee pain issues, what do you tend to do as far as programming for them?
Yeah, so starting them out with very low volume at the beginning, but something I really like to do are your individual leg training. So if you're on an indoor bike, this exercise is a lot easier than outside, but pedaling with one leg and really getting that smooth, efficient pedal stroke with each one. Some people find that left leg is much better than the right or vice versa. So really working on having both legs pedal smoothly and efficiently is helpful in that. Keep it really low resistance and high cadence to prevent them from having that injury come back. In any athlete, any cyclist, really whatever sport you do, cycling, it's critical as well as your core exercises. A plank is a great way to use all of those core stabilization muscles, but having a strong core is what holds you on the bike. It's what keeps you upright. That is often something that people complain about is their lower back hurts or different areas of their body hurt that they could prevent by using their core muscles and engaging those.
And that speaks volumes, because the second most common complaint we might see are upper extremities. So the neck, shoulders, wrist, and hand, that patients may complain of fatigue, numbness, loss of sensation in the digits with prolonged hours on the bike. And those are patients we identify in the office as having core weaknesses and deficiencies. I think relying on the hands to support the upper body on the bars is improper technique.
Even in just safety of handling, I mean, when you go to grab a water bottle, if you don't have the stability to keep yourself up, even with just one hand, and you're relying so much pressure on both hands, that's an accident waiting to happen. We try to take functional positions where people are going to be on the bike, and how do we challenge their core in those positions, and we tend to find some really good results. But even if, with core in mind and just, neck and hands and, all the symptoms that you can get, making sure your handling position is really optimal on the bike. I always really like to, think of like, if you're gonna put your hands in the hoods, it's like kind of shaking someone's hand. You want that, meaty part of your, between the first and second digit to kind of be, situated there. So that way you're not pushing on all these nerves and other, bony structures of the hand.
Looking ahead, everyone's excited at SBT Gravel and other events to look forward to or plan for the season. So if you're the never ever and the first bike you've ever bought is your gravel bike and looking to increase miles, make that century ride achievement, what resources does SBT Gravel or physical therapy play in keeping you out of my office and preventing injury altogether?
That's a great question, and we have taken a lot of time to put together a website that has a wealth of information. So that includes everything from a nutrition plan and what to eat before, during, and after a ride, as well as a training plan. And if you sign up for the 37-mile green course all the way to the 144-mile black course, there are training plans that are up there.
And with our physical therapy partners, I think Steamboat Orthopedics has helped contribute with some bike fitting information. Also, Ray, if you can speak to what we can do in injury prevention.
Yeah, on the website we're going to have some great bike fitting tips. You'll see me go through some fitting suggestions. But one of the other big things is we'll have exercises up on the website, just things that you can be doing for your core and for your legs just to keep strong. It's great for cross training off the bike, and that way you've got this good model going into your training for this race.